Everyone. Welcome to our East Valley gathering this wonderful Thursday morning. I am pleased to introduce to you all Dr. Deliman. And Dr. Alan Deliman is a chiropractor. He received his Doctor of Chiropractic at the Los Angeles at the Los Angeles Chiropractic, and he practiced for just under 10 years in San Francisco before moving to the East Valley. He's been practicing for more than 30 years and became certified in Webster technique in 2002. Since then, he's included and sought many forms of continuing education, especially to care for parents and children as a regular part of his Chandler practice. So Dr. Deliman, welcome. You're going to be speaking to us about caring for, in a chiropractic sense, pregnancy and early childhood and postpartum. So we're excited to have you.
Wonderful. Thanks for inviting me.
Absolutely.
You gave me a nice little introduction there. So, yeah, I've been practicing since 1988. Hard to believe. I first got interested in I took a seminar in 2002 about the Webster technique, and that was very enlightening in a lot of things. They talked about some medical things that are done in pregnancy that you don't really have to do, but if you go opt out, which you can do. And I thought, oh, really? Wow, because my kids are a little older. When I had my babies, I didn't know any of this stuff. And my wife wanted to go full hospital, bells and whistles, and she's the one giving birth, so what can I say? So, that is a personal choice. I'm going to go over some things as we go along about some options that you have. But then I met a lactation consultant, and she started talking about some issues, and I started doing some more study into neonatal stuff. And there are just some specific things that happen with, uterine presentation, delivery, some stuff that's fairly common, not dealt with. It could lead to further problems down the road. So I love to get the little babies in here. It's just a joy of my life. Some days I'll have 3 or 4 babies in a morning, and I'm like, yay, babies. Then I get to play with them and then give them back.
That's the best part of having grown children, is you can give the babies back, right?
Yes, exactly.
Hey, I hate to interrupt you, but I wonder if cracking your door open actually might help. Your signal is cutting in and out just a little bit. And I want to make sure that it's clear. I'm not sure where your router is located in your office, so.
Yeah, I don't know if that's going to help at all.
I don't know either. I'm not sure. Do you know where your router is located? And
I don't. Yeah, I'm on the cell.
Oh, I see. Okay.
Because usually when I try to do a Wi-Fi thing, it gets worse.
It gets worse. Oh, gotcha. Okay. No worries. We'll do the best we can. It's all good.
Can you hear? I mean, is it like bad?
No, it's not too bad now. I think it made it a little bit better. And maybe if you're close to a window, if you can scooch closer, that might be helpful. Sometimes that helps signals. I'd rather do it now than later, right?
Right.
Yes.
Exactly. Well, I'm halfway between the door and the window.
Perfect. We'll try that.
Okay. All right.
Go ahead and continue. Sorry for that interruption.
That's okay. And who is it? Was it Feather that's a nurse? Great.
Yeah, Cassandra. Yeah.
Daughter, or is it Cassandra, or both of you? All right. So my oldest daughter, I have to brag on my kid. She's 21. She just got her BSN RN, and she's moving to Seattle and has a job already lined up there in neurotele at Swedish Cherry Hill Hospital up there. So she's on her way up there now. So it's very exciting. And my youngest daughter, who's also, they both did U of A. So My youngest is a sophomore now, and she wants to be a nurse midwife. So pretty cool. So I'm super proud of them. And if you want to talk more about my kids, we can go on and on. But I will move on. All right. So first thing I wanted to talk about is preparing for pregnancy. You know, sometimes it's like, oops, surprise. But if you're planning a pregnancy, you want to get pregnant, the more advanced work you do toward that, the better experience you can have. Simple things, nutrition, exercise. I mean, it's pretty common sense things, but it's not really emphasized medically. So it just needs to be reinforced. You know, if you have a strong, good muscle tone, a strong core, you get a reasonable weight, you're going to help yourself prevent more difficulties just in bearing the child around, and also with gestational diabetes and things, you can, you know, limit your exposure to that potential. So that's something, if you look a year or two in advance, you can do a lot of work and say, okay, I would like to be pregnant around this time. Let's do some things. So my body is in the best shape as possible it could be for that. So that is kind of common sense. I don't know if anybody has any more specific. I guess I could take questions after each little topic, I suppose. Does anybody have anything you want me to expound on with that? No?
I think
All
you're
right.
good. Yeah.
Okay. So, and the thing I also want to talk about is our healthcare system. You know, the US, we don't have the best outcomes. So there's all this medical stuff that's done that is not always necessary or helpful, and some of it's dangerous. You know, so our infant mortality rate is pretty low on the list of whatever first world countries. So we could do better. And so, unfortunately, our healthcare system is sort of profit driven. So some choices are made that, you know, don't always have to be made the way they are. So certain things when you're pregnant, you know, there are risks involved with diagnostic procedures. People know about amniocentesis. That's not done a lot, but sometimes it is, and that's can have its risk. But even ultrasounds, you know, ultrasounds create heat and can create problems, you know, and the wattage that they use for the diagnostic ultrasound is fairly high. So that's not something that you always need to do. And sometimes you're placed in a category, oh, you're advanced maternal age, let's do an ultrasound every month, blah, 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 you know, all the way down. And then you go, okay, I guess I got to do that. You end up having 6 ultrasounds. That's maybe not necessary. So things to think about, things to ask questions about. You know, everybody's an expert now. So feel like you can, thank you, Cassandra. You know, everybody's an expert now. You know, so these sometimes medical people are not used to being asked questions about these things. It's just, well, here's the protocol, this is what we do. But you have a right to ask these questions. It's your body, it's your kid. So don't be shy. And let's see what else I can talk about. So kind of some nutritional things before you're pregnant. You know, you hear about folate and magnesium and different things in your diet. I'm kind of a whole food diet kind of person. There's too many nutritional things to keep track of, and it's not really my specialty. So I cannot expound on every little vitamin that you need, but leafy greens, whole foods, omega-3s, you know, not a lot of saturated fat, just good diet, you know. Limit your drive-through activity. And also part of our culture, it's like, oh, we just buy food and eat in our car as we're driving somewhere else. It's like nobody stops to sit still to have a meal. So that affects your digestion as well, just being, you know, in that moment, you know, mindfulness with your food. I don't think we emphasize that enough. I think one of your speakers was talking about that last week. Yeah, so that's important. Okay, so I have some notes here. I'm just peeking at what's going on here now. Some of the things that happen while you're pregnant, your body secretes relaxin so that you can dilate and deliver. But that can cause its own issues because it affects all the ligaments in your whole body. So things are kind of shifty and move around, and that can lead to pain, discomfort, and also you picture your silhouette when you're 8 months pregnant in the mirror. It's like, just looking at that looks painful. Your spinal curves are all accentuated, your lumbar curve, and you're balancing out your baby in front. So then your head's tilted forward. So your neck curve, your upper back, your lower back, all these curves are several degrees more than they are normally. So that wherever those curves change direction, that's where there's extra stress on the spine, just normally. And you add that into it. You add the pregnancy, you add the relaxant into it, and it's no surprise that you could have some pain. So I have tricks for that as a chiropractor because, I do get some referrals from midwives and things with pregnant moms, and anything I can do to make them more comfortable, as a man, it's the least I could do, right? So let's see. So the Webster technique, Sarah mentioned that, and that's a technique where we're not actually, what you do is you find out your breech. Typically it's like 32 weeks because the babies can be breech for a while, 29, 30 weeks. That's kind of normal. But if you get to like 32 weeks, they're just kind of stuck there. Then we start saying, okay, this is actually breech presentation. And what we do with the Webster technique, we kind of take care of to say we're not actually turning the baby. We are creating an environment where the baby will turn on its own. So we have certain points we can stimulate in the sacrum, the pelvis, the round ligaments of the uterus, get them to relax. The uterus kind of goes, oh, and then the baby's got room to turn. So that's kind of what we're trying to do. And what I'll do is I'll get a mom, sent over to me, and we do that every 2 or 3 days for a couple of weeks. And sometimes it happens right away. Sometimes it takes longer. I've had a mom, get out, get to the car. She's driving home. She calls, the baby just turned. So that's always fun when that happens. And sometimes it gets stuck in there and it doesn't work. But it's certainly worth the try because it's super gentle, and it's probably 50 or 60% of the time it works. And, when you get medically, what do they call that version where they shove the baby around and, that's scary and that is risky too. So if we can avoid that, it's much better. Of course, if you come to me and you're 39 weeks pregnant with twins, I'm probably not going to be able to get them to turn. They're going to be wedged in there pretty good. Well, so usually if I get you 32 to 34 weeks, we got a pretty good shot at getting them to turn.
I was just going to ask that. What would you say would be the ideal time to come in to see you if that's the case where you are?
Well, sometimes you don't always have a choice. Sometimes you don't find out until you're 36 or 37 weeks. Right. But if there's screening for it, unfortunately, sometimes this screening is obtained through ultrasound. So that's something too. But 32 to 34 weeks is ideal, the best chances of getting the baby to turn. All right, and then the pelvic and low back pain specifically, you're getting that relaxin, your pelvic, your pubic symphysis, it's like slowly expanding, getting ready. Sometimes that can be specifically painful at that pubic symphysis. So we have adjustments for that where we can kind of approximate that and get that more comfortable. So I've had moms where that's their only complaint, and we just work on that. Sometimes it's the lower back, it's just super tight, super painful. And sometimes somebody will have an underlying condition, an old injury, or they're just kind of torqued to start with and never had it addressed. then you throw that extra stress in there and their back starts screaming. So we can work with that. Also the headache, upper back pain, that's all real common. And then as you get further on, sometimes there's water retention and some edema, and you get like numbness and issues like that. So I can help with some of that. We get the nerve flow, the circulation improved a little bit. And that's also something where, exercise will help as well, dispersing that, and there's not a lot of restrictions with pregnancy unless you have a medical thing where you have to be on bed rest or something. And you can adapt to things. I'm a big fan of yoga. So, yoga's good. Pregnancy yoga, there's, specific things, of course, you can't do when you're, 38 weeks pregnant, but you can do most of it. So that's helpful along with that exercise and nutrition I talked about. Preparing, you do that during your pregnancy as well. So your body's staying in shape and adapting to what's happening to it. All right. And then, so you're going to have your baby, right? So you have a whole lot of options about what you can do. Let's see. So there's all these options medically about what you want to do. I mean, you can go have a home birth. You can have, a natural birth at a hospital. I think Mercy Gilbert will do that. Some hospitals won't. Some people go to a birthing center. I mean, there's some beautiful birthing centers. And, there's little things like it's easier to have a baby if you're squatting than laying on your back in a bed. And, some hospitals don't get it. So there's things like that are just seem basic. There's a birthing tub, having a water birth, all these kind of things. And you can have a hospital birth with, some of the bells and whistles. You can have the hospital birth with all the bells and whistles, C-section. Here, let's do this at 6:00 on a Tuesday. That's usually not mom's option, but sometimes it's the doctor's option. It's easy for them. Sometimes if you've been in labor for a while, it's like, I just want to go home. Let's get this over with. And we're all people. So certainly that does come into the decision-making process sometimes. All right. So any questions at this point?
I have a question for you. So what would you say that you've seen as far as outcomes in mom's comfort levels and pain after birth, dependent on how she birthed? So whether that was in a more natural position versus, lying on her back in the bed with, her feet in stirrups, right? Have you seen differing outcomes between those kind of two general styles of birth?
Yeah, I have seen, if you're in bed, feet in the stirrups for a long time, an extended labor, just laying in bed that long without having a baby would give you back pain. And here you are giving birth.
Yes,
so,
that's very true.
Yes. And that's a big one. And I've had moms who had a birth at a birthing center, went home, and, they're bouncing around in a day or two. So there's some differences there for sure. And then, of course, if you've had, an epidural, all these other things, and you get induced, that does affect things as well. So if you're comfortable, go ahead.
Oh, and I was going to say, specific to epidurals, I know I've experienced a lot of women who have lingering back pain, even nerve pain, especially depending on like how that epidural was placed. And oftentimes, they can be a little off. I mean, you're kind of shooting in the dark in a sense when you're placing epidurals. How do you feel like you can benefit, if that's part of what you're experiencing, from chiropractic care? Is that something that you treat?
Well, sometimes there can be some local inflammation from the epidural that affects the nerve root there. And if we can disperse that and loosen things up, that can help a lot. Now, sometimes you have that puncture, and some women have long-term pain and issues just from the epidural injection. You know, it's poking into your spinal fluid. Some women end up with headaches, you know, chronic headaches afterwards. Sometimes there's that local pain at that injection site that will not go away. So it is a, you know, a big decision to make to get an epidural, you know, because those long-term effects, it's not a tiny percentage. It's a fairly reasonable chance that some of those things could happen, and you're carrying that around for years. But sometimes I work on them and it clears up and they do fine. So obviously that's what we want.
Yeah. I know from my own experience at your office that you do some muscle stem work. Is that something that you would utilize for a postpartum mom or a mom within pregnancy, or are there
well, during
kind of
pregnancy,
guidelines? Yeah, for
during
how
pregnancy,
long?
we don't use any electrical modalities or the therapeutic ultrasound, which would be typically used for a sprain or an injury. We don't do that, once again, because it creates heat, and we don't want that around the baby. And so I tend to avoid all that during pregnancy. It's not super risky, but let's just avoid it all. But certainly I can do some muscle work and some percussive therapy, some trigger point work to help relax the muscles. But after you have the baby, we can incorporate some of those electrical modalities if we need to. So yeah, definitely.
Awesome. Thank you.
All right.
Does anybody else have questions regarding some of these things before we move on? No? Good. Okay.
All right. So then you have your baby, and then you get home, and now you have to carry this baby around and do things, and then other stuff starts to hurt. So moms make really good patients because you're carrying around your baby and you're bottom of the list. You're responsible for everybody. And so usually the moms, when they come dragging themselves in, it's like, okay, I can't even function. I need help. Otherwise, they try to tough it out. But you're in these prolonged positions, you're in the chair, it's like, oh, he's finally asleep, and then you're like laying with your head like this for 3 hours because you want to nap too. Then you wake up, oh. So these are things that just happen. So these are, you're still dealing with that relaxant. So your body will be producing that relaxant for 4 or 5 months after you stop nursing. So that whole first year or more, at least, you're going to have some of those ligament issues. So it's a good idea to get adjusted and get straightened out, because you're going to be in those chronic positions and your ligaments are going to shift a little more than they would normally. And if we don't deal with that, then things just try to stay like that, because you're going to be holding the baby in your left hand and using your right hand. Things like that are these repetitive chronic postures that you're going to be performing over the next couple of years at least. And so your body is going to try to turn that way. You've probably seen the grandmother with, one hip's higher than the other because she's been carrying babies and grandbabies, for decades. So you don't have to become permanent.
Or diaper bags. Right?
Diaper bags.
Oh my goodness.
Yes. The diaper bag becomes your suitcase. Like, well, I'll put my phone and my stuff in there too. And it weighs 15 pounds, and the car seat and the baby and all the gear. So it's challenging. So I can be helpful with that. Some moms, bounce back pretty quick, and I just see them a few times. Some of them have some issues or new issues from the baby, or some leftover issues from the pregnancy. So every case is different. And then you are trying to get back in shape, maybe a little exercise, and that's where this relaxing can be a thing, because your knees, your joints are a little more susceptible to injury. So if you want to stay, if you're more aligned, your weight bearing is going to be more symmetrical. You're going to be just putting less weird strain on your joints, and they're going to be happier and less prone to injury. Now, some of the things that I see with specific things that I get from lactation consultants like Sarah, and moms come in and they have issues with latching, and maybe the baby will latch on one side, maybe not the other side as well. And sometimes they have been intrauterally positioned like this, and they're standing on their head for a couple months, sometimes if they're in position. And so they come out that way. Or depending on the exuberance of the birthing process, things get munched there or pulled out. And, I don't know how many forceps things happen anymore, but that used to be an issue. So there's a lot of trauma that can occur. The baby comes down and turns and pull it out. It's like, duh, why wouldn't that be an issue? So medical people tend to not have any training in this stuff. Like you had your speaker, the medical student a couple of weeks ago who had her baby and they don't want to do anything natural. They know, why would you go to chiropractor? It's like, they don't have any training. They don't, there's nothing they can incorporate into their practice or billing. So it's like, whatever. So they're not that interested, most of them. I have a few that are a little more enlightened that understand, it's the more helpers we have in this whole process, the better. But it's still the minority.
It takes a village, right?
It takes a village, and you're making the village. Thank you. Yes, very good. So I will get a baby coming in, and I don't know if others of you have been to chiropractors, but when I do the baby, it's very gentle. There's no head spinning going on, just so you know. I always talk to the moms, and the moms are so funny because I could tell if it's the first baby, they're like hyper vigilant. They're watching me. What are you doing? And then by the third baby, they just hand them over here, fix them. It's a whole different mindset. You say you can help, just do it. So it makes me laugh every time because we get tired. Definitely. So the most common thing I'll see with the babies is this neck rotation, where they put them in the car seat, heads always turn like this. They fall asleep, heads always turn like this. So that's where the latching, one side they're, oh, this is cool. And the other side, they're like, hey, my neck hurts. And so they don't get as comfortable. Sometimes they're laying on the side of their face and one of their TMJ is kind of twisted here, and that can affect their mouth opening. I had a baby once where she would cry. She couldn't open her mouth. So she'd go, hee, hee. So her mouth just went sideways when she was crying. She couldn't open her jaw. So I was able to work on that a couple times, and then she was fine. So I will check the jaw, I'll check the neck, and I just do a little kind of range of motion, feel where it's restricted. And it's just really a little gentle pressure. I'll have them sitting on my lap, and I have their neck like right here. And I'll just maybe lean their head a little, feel where it's restricted, and just kind of little lean, and there's no sudden moves or anything like that. So once mom sees that, they're like, oh, okay, that's cool. That's not scary, but I can kind of get
I
the
often
temp.
tell my patients that there's no popping, that we don't pop babies, right?
No,
It's
we
not
don't pop baby.
It's not the adult version of going to the chiropractor and experiencing like your back popping, right? It's nothing like that. It's nothing drastic. It's like you said, very gentle, very, very much in line with, what that baby needs to be experiencing at that time, being cuddled up, being held, being,
yes, and their bodies are super intuitive. And sometimes I'll just lean something and I'll feel something move a little bit. Sometimes I'll hold them up and something will move in their middle back, and just their body weight, just getting it aligned and settled in. So I'll check the TMJ, the neck. Now, some other issues that present, sometimes they have a lot of reflux, and sometimes the doctors want to put them on like baby Pepsid. It's like, really? It's not even good for adults. I don't know. Let's not do that. So what I do mechanically, I'm looking at the diaphragm. If things are tight here, the kid's been fussy, crying a lot, everything's tight, it can kind of slide up your stomach a little bit into the diaphragm. And I see this in adults. I'll do the same kind of move on a full-grown adult, and I've gotten people off of those heartburn meds by getting things realigned here. So I have little moves to help relax their diaphragm, and sometimes something in their middle back will be related to that. So help with the reflux a lot. Sometimes they're constipated, so I'll see something in their lower back. I can realign that. And one of the two most common things I'll see after a baby, their first adjustment, they go home, either they take a giant nap for 3 or 4 hours, which is nice, everybody gets a little break, or they take a giant poop. I've had them blow out before they even leave my office. And so that's good. It's always good to clear things out. It's good for all of us. So, and then what else is common? Now, when they get a little older, sometimes the ear infections, that's a big one. You run to the doctor, you get your antibiotics, and then that doesn't work, and you get some more antibiotics. Let's not go there. I've saved a lot of kids from that just by getting things mechanical. We're working with your body to help itself. So when you have your ears are supposed to drain, it's a self-clearing system, ideally. I think the American Academy of Pediatrics came out in 2004 and said, do not give kids antibiotics for ear infections. But they still do because they don't know what else to do. And the parent comes in, I got to have something, blah, 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 whatever, and they just give them out. So it's really not ideal. And then taking antibiotics can mess with your flora, your gut flora. And this is something babies need to develop. They get it from breast milk, and it slowly builds up. And then you kill it with amoxicillin. And, there can be some problems with that. And now we're talking about this connection between the gut and the brain and brain development. I mean, there's a lot of stuff that we don't really understand all the way yet. So just wiping everything out like that, there's some consequences to that should be looked at. So what I do is, what I'll find is usually there's some congestion here, sometimes the lymphatics in the upper neck. So everything's just kind of stuck here. So then you have this little petri dish in your head for infection. So what I do is try to get the ears to drain. I do a little ear adjustments, and it actually helps the eustachian tubes drain. I'll work the upper neck, the lymphatics around here, sometimes adjust a little something here, and that helps things drain. And sometimes it's one treatment's pretty dramatic. Some kids I'll have to see 2 or 3 times. So I always mention that to the new moms because, when they're a month old, they don't have to deal with that yet, but it could come up. And then another thing that comes up earlier is colic. Colic is that screaming, crying, frantic, inconsolable thing that happens like at the same time every day. And your kid's like 3 weeks old and you're like, oh my God, I am a failed parent. I do not know how to soothe this child. So it's very devastating to the parents because they're so young and your kid's so miserable. So what I do with that is I'll find something in their lower mid back. Sometimes it's some digestive things. I'll get the kid on some baby probiotics and do some adjusting, work the muscles, work the lymphatics, just try to get things lined up. And usually that's helpful. I might see them 2 or 3 times for that, and the colic will clear up because that can last for weeks and really make you crazy. So I try to mention that if I get a new one. Usually if I get them and they're 2 or 3 months old, we're sort of past the point where that might be an issue. But if I get them earlier, then I can say, okay, look out for this, and then bring them in. All right, what else? Colic, latching, da 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 da. Okay. Good. Question time.
Who has questions? I know I have a few in the gate, right behind the gate here. Anybody on the call?
I don't have any questions, but I think it's really interesting that we can help our babies in this way. I know what I used to do with my daughter was I would just rub her stomach and do leg movements, but I didn't know you could do all these other things with them.
Yeah, it's quite the gamut, and I don't think any of us really realize, because like you were saying, Dr. Deliman, it's something that if we are in the more mainstream scene of healthcare for our pregnancy and for our labor and delivery of our baby, birthing, afterwards we just sort of tend to trend towards those more mainstream things unless we know otherwise. And so I know with my early kids, I had no idea these things existed. And I remember very clearly, which, and I may be jumping ahead here, but something that you had helped my youngest with when she was little was, you know, those hard falls that babies take when they are learning to walk and they sit down hard. And you think of, yeah, you know, you think of the impact of like a car accident, right? And you get this whiplash effect. It's the same thing in some ways, in a lot of ways for baby, they fall hard, and we wouldn't even think sometimes to take baby in to get treated for that. When we are going in, we're sure going in if we're having neck pain. But because babies can't tell us what they're going through verbally, sometimes it makes it hard as a parent to, you know, distinguish those cries, distinguish what's going on. And so these things really can and do have a lot of crossover to what we're experiencing. So I appreciate just the, you know, how simple and intuitive it sounds when you bring it forth, but then to actually know that there's this outlet that we can go to for our little ones. And there are ways that we can help support them, especially when they're having tough times. Because I don't know about anybody else on the call, but I had a colicky baby. Thankfully, not more than one. It was just one. I consider myself lucky, 1 of 5. but the one was enough, right? I mean, that was enough to understand what many parents go through when they do have a colicky baby. I mean, you're overwhelmed already just being a parent, let alone having a baby who you can't set down, who cries constantly, who anything and everything you try seems to not work for more than a second. And for me, in my experience, it wasn't just at one particular time of day, it was a lot of the times of the day. And so it's so hard. So knowing that we do have this village of support that includes providers like you that can help us take that extra step towards health in our own bodies and then for our infants as well is just so awesome. It was not necessarily a question, but just my 2 cents. Let's see. In the chat, I have some questions or comments here. Let's see. So, let me see. Sorry, I'm trying to read at the same time here. Oh, well, so Megan is saying that she's excited to explore this further to see, you know, how this can help with both kids and women, right? And especially pregnant women. And then as a sidebar, she's wondering, she's heard things about chiropractic helping dogs and animals. Is there truth behind this? Can you enlighten us briefly and divulge this question?
The answer is yes. They are vertebrates. They have spines. So I don't have any special training, but I've done a few dogs informally over the years, and it's definitely noticeable. So it's real. Now, some doctors specialize in veterinary chiropractic, and there's all kind of training you can do for that, which I have not pursued because I like human babies, and that takes up a lot of my time. But yeah, definitely.
How neat. That's so cool. Yeah. I think cool. I've vaguely heard of like somebody working on horses.
Yeah. Oh,
which
yeah.
seems kind of intimidating.
Yeah.
I mean, like, I think I'd prefer infant babies personally.
Yeah. Horses are big. I think I've seen where they have like mallets and they whack on them and things. So it's like a horse is a very large animal. So
that's much different from working on a mama and a baby. For sure. Oh my goodness. Well, I won't take up any more time with dogs, but go ahead and yeah, continue. This is so great. I'm taking this all in.
All right. Let's see if there's anything here that I haven't covered. Oh yeah. Now, of course, you know, as lactation consultants, you are lactation advocates. And there was something I read here. When the baby is nursing at the breast, there's a chemical reaction that actually produces hydrogen peroxide as an antibiotic. So this combination of breast milk with the baby saliva produces a strong enough reaction to inhibit the growth of staph and strep. And I thought that was pretty interesting. And that's just something that's just designed, part of the process. Isn't that cool? Let's see, anything else fun I can, and then with babies, there's some other things that we'll see. There is some research going on. It's interesting as far as developmental issues, kids on the spectrum, things that happen as they get older. The chiropractic, we're looking at the neurologic system, your brain, down your spine, through your vertebra, out to everything in your body. So everything can be affected. And some of the things we work on, think about vestibular is like your balance, your cerebellum. That's an important part of your whole function. Now you see babies who are, they're trying to walk and hang on to things and they're wobbling around. All that balance that's going on, that's called proprioception. And that is just shooting signals up and down your brain, going up here to lighten things up. And that's a huge part of their development. And that's, in crawling, that cross-crawling movement, that is organizing your brain as well as it's developing. And we need that throughout our lives. So that's something that people can do. We sit on our butts in a chair all day, making a living, we get away from that. So if you, even for adults, I'll prescribe for my patients some balance things, a little balance board or the one-legged kind of yoga poses where you're balancing. And that is just really good for your brain. And that can help with attention issues, all kind of things. So that is just kind of an aside, something to think about. Let's see if I can find any other fun stuff in my notes that I didn't talk about. Any other questions?
Hi, it's me, Sam. I just kind of wanted to highlight what you guys were talking about earlier. Like, there's not a lot of crossover when we're talking about prenatal care, even infant care, that chiropractic care can be a way to like boost whatever we're trying to fix. And so as you're talking, I'm looking up the Webster technique. I've never even heard of that or that being a possibility. And so because we work with a lot of pregnant moms and families, I'm wondering, how do you kind of address the nervousness of families who have maybe never gone to chiropractic care or, don't really know what it's like? And to be honest, I've never seen a chiropractor. So what would be like the best way to explain it to a family that's, we're introducing the concept or the possibility of seeking care this way?
All right, that's a great question. The way I look at it is we, as chiropractors, we're working with your body to help itself. So in fact, if you look at it that way, it's the least invasive intervention you can imagine. Anything medical is you're affecting your biochemistry or an antibiotic or whatever, hormones, surgery, everything is much more invasive. So chiropractic is just more of it's extremely safe. And that's the thing I think people just aren't aware of. Now, depending on the doctor, like I work with Agave Pediatrics here in town, and they specialize in the frenulum, the frenectomies. And so I get referrals from them because they know that sometimes it's part of all that's going on. And so these are medical people that are aware of what we do. So they hype us up a little bit. And I think it's just ignorance is a big part of it. Like you said, you didn't know, nobody taught you, you didn't learn any of that in school. So it's like, it's just part of the education now, because there's so much, I don't know, advertising and everything. You get this thing, these medical treatments are the only way to address problems. You just watch any television show and you'll get 18 different ads for some medicine. You can't even pronounce the name. They've obviously run out of good names for meds because the latest names are really weird. I've just noticed that as an observation. So people think that that's healthcare, and that's really not healthcare. That's sick care. We're taking care of you after you got problems. So many things you can do to prevent these things, but who's making money off that? The medical establishment is not designed for that. The reimbursement system is not designed for that. There's no code, here's an hour of lifestyle coaching, let's see, we'll bill for that. So it just doesn't happen. So, and then as a nurse, you're seeing more of the crisis stuff than if we could prevent that. So I think it's just, I try to interact with as many medical people as I get the opportunity. If I hear about somebody who's referred, I'm like, I'm gonna go say hi and see if I can just spend some time. So I think it's just that connection where they know me, okay, he's not some crazy person, and I have them, they're open-minded, and so we can work together, and it's to the betterment of the patient. And it should be the ultimate goal, but unfortunately in our dollar-based healthcare system, it's not always the case.
If I can chime in here too, I think from the perspective of working with patients for lactation concerns and talking to them, Cassandra, about the possibility of chiropractic being an option for them or for their baby. There is a lot of, I think, incorrect stigma surrounding chiropractic care that's not necessarily current, but has been developed in the past maybe 2 generations that I see coming forward sometimes, like, someone's mother or grandmother, oh, no, don't see chiropractors. That's not safe. Like you were referring to, it is a very safe practice. And I think the more we can talk about the safety of it, usually where I tend to go with, private clients, right, is this is a holistic approach. It's looking for the root cause of what we're seeing symptomatically in this baby's body, or an inability that they should have, a mobility that they should have and don't. And so I kind of take the approach of introducing it in the sense that this is holistic. This is not a helmet for your baby. Nothing against helmets necessarily, but this is not a helmet for your baby because their head is misshapen. This is why is their head misshapen? Let's get to the root of that issue. And chiropractic certainly is one of the ways that we can find out what's going on underneath to cause that, and then go forward with that, right? Again, with neck tightness, like you were talking about earlier, Dr. Deliman, right? Like there's a root there.
I'm glad you brought that up.
Yeah.
Because if the kid is laying on one side all the time,
that
leads to their head melting, and then you have to wear a helmet.
Yes.
So I like to think I've saved a lot of kids from helmets because I got a hold of their neck and straightened out their range of motion early on, because that head melting, you start to notice, hey, my baby's face is crooked at like 6 months, and then you have to do all this stuff. And so if I get them when they're young, a few weeks old, then we can avoid all that.
Yeah, I think that's one of the things that parents can benefit from a lot, especially going back to the conversation about, your labor and birthing experience. If you have, like you were talking about, the exuberance of the birthing process, right? I mean, I've seen
That's
personally,
one word, right?
Right, the exuberance. I like that, actually. It's a fun term. One I haven't used, but may start. I feel like the faster the birth, like the faster your labor goes, the more inclined a baby is going to be just naturally and physically to have some sort of issue going on with tightness, simply because they just shot out, right? Like, and then I see too with like, different cesarean sections, depending on the doctor delivering that baby, depending on their practice and how they're holding physically that baby, the methods that they use to take baby out, you know, and birth that baby, like they could have neck tightness that stems from that. Or like you had said earlier too, I've had many parents whose baby is transverse, you know, for much of the pregnancy, you know, just crammed down in the right side, and mom's pelvis is on fire, and delivery is painful, you know, and then baby comes out and their head is like, you know, kind of wonky, and it's no one's fault, right? But
Right.
there are definitely things we can do to then ease that transition into this world, for baby, and then for some of the things that I think moms experience physically,
Yeah.
after
Absolutely.
birth. Yeah, in that way. So
And sometimes people have just not thought of that. And when you point it out like this, you're like, duh, why wouldn't there be an issue? And the whole thing with chiropractic, I mean, it goes back where the medical people really, we had a lawsuit in the 70s and 80s because the medical people were trying to get rid of us. So they would, you know, print these hit pieces, and if you referred to a chiropractor, they would kick you out of the AMA. And literally they did these things. So we had this lawsuit that we actually won in 1987. Remember, I was still in chiropractic school when that happened. And so they had to print retractions. They couldn't do these hit pieces. So they kind of, this whole culture of a couple of generations of them just throwing out this negative stuff. So, I mean, even though that's 35 years ago, there's still some of that stuff lingers. And then, so that's based on what you were talking about before. And then just the whole system as it's designed, whoever is providing that medical care, there's no financial incentive for them to work with the chiropractor, an acupuncturist, or whatever, because that's, you know, there's nothing for them to bill for or anything like that. So because we're in this, you know, fee-based, profit-based system, that tends to be part of the decision-making process, unfortunately, much to the detriment of the moms who could use all the help they can get from wherever source.
Yeah. You guys say it so wonderfully. I'm working with a mom right now whose kiddo was diagnosed with flagiocephaly and wore a helmet, and mom did all the things. She got the helmet off really quick, but now she's being referred again. And the baby's only been without the helmet for a few months, and now we're back here again. And so it's quite interesting because why? And so it's such wonderful timing, because now we can have a discussion about, like, have you ever thought about chiropractic care? And maybe that's an opportunity to explore. So it brings up another question, because with Nurse Family Partnership, we often work with low income moms, or a lot of our moms have access. Is chiropractic care covered by access?
Well, it's not.
Okay.
But the nice thing is chiropractic care is low tech, so it's not expensive. So
Okay.
I mean, if I see a baby, you know, regular adjustments like $45 and out of pocket, and some of the insurances they don't want to pay for babies anyways, so I let them know in advance. And so most people, sometimes that would be your copay anyways. So
right.
it's not that expensive.
Actually, so with access, I do actually think that some access plans do account for chiropractic visits. I think it's more of a provider, though, like whether
I had an experience. I was given the opportunity to sign up for access.
Okay.
I don't know, 6 or 8 years ago. So I did. It's like the more people I can help, the better.
Yeah.
But it was a funky system, and I never got paid.
Certainly.
And I think I got paid once. And it was just very unwieldy. I don't know how the providers who only do access, low income stuff, I don't know how they get paid. But for chiropractic, it was a mess. So I opted out of it after a few years. But I gave it a try.
Yeah.
It certainly makes sense that everybody should have the opportunity
exactly.
to get the care.
Exactly. So yeah, and I would just say, Cassandra, for the moms that you care for, you know, if one provider does not accept their healthcare plan through the state, try someone else. Have them call their provider. Maybe that's something that you guys can do as a go-between in your role, and call or go online, you know, sign into that parent's account, look into those benefits, because certainly Dr. Deliman is right. You know, we all should have access to this care. And it does get very frustrating on state healthcare at times when you know, low income families cannot access the certain things that they need, or they can't access them easily, or they're extremely hard to find quality care within that system. So I'm no stranger to that, the systemic issue, but I think it is, you can do it. You can find care providers. It's just more challenging. So
Yeah.
I wouldn't stop looking though. And I wouldn't necessarily say that across the board there are no providers. So just to put that out there, because I know you know, that low income population is very near and dear, and I want everyone to have that opportunity. And so the more we can do to help people to find the providers that do take access, and I understand the background, you know, of being that provider and the challenges that arise when you're the one having to, you know, kind of try to pick your way through that system. But the more the better that can fill that role.
Absolutely.
Right? So, yeah.
Well, thank you so much.
Does anybody else have any questions before we move on? No? All right. Well, we have, why don't we, if there's anything that you want to add, Dr. Deliman, in the next few minutes here to round out our time, I would love to also give an opportunity for us to speak a little bit more privately if there was anything more specific that any of the people on our Zoom would like to discuss today off of Facebook Live. So we'll have about 5 more minutes here on Facebook Live, and then we'll pop off of there to talk about more things. Does that sound good?
That sounds good.
Okay.
Yeah. I think I've covered pretty much the things that I want to cover. So I talked about the pregnancy stuff, the aches and pains, the ligament laxity, and then the nutritional, getting ready for pregnancy, diet, exercise, the common baby problems with the neck rotation. And I do mention that with the plagiocephaly, I will point out to the parent that, look, if your kid's always going to be laying on this side for the next 6 months, this is what could happen. So let's work on this now, and maybe it won't happen. And I've had, of all the kids I've seen, I've only had a couple who have progressed to needing the helmet down the road. So I like to think I had something to do with that.
I second that. I think you absolutely did, because I've never seen, honestly, in my years of practice, I've never seen a baby not respond well to chiropractic care. So there's always a positive benefit coming from it. If a mom chooses to take their baby there, their parent chooses to seek out that care. So thank you for what you do, Dr. Deliman. You're definitely one of those pillars in our community, striving for the betterment of this care for mom and baby throughout their pregnancy and even before, and then afterwards in the postpartum and for those little ones. So you care well for them. Thank you.
Well, thank you so much for inviting me and having me on.
Absolutely. Thank you so much for agreeing to come on and chat with us. I think this was a great conversation. Before we pop off of Facebook Live, I just want to encourage everyone that we do have a break next week. So take advantage of that morning to do what you would like. Wednesday morning will be no gathering, but we will have the following week. So I believe that's Wednesday, July 28th. Am I right, Megan? Is that, yep, okay. We will have our Tucson gathering here, same place, same time, different registration link, and Megan's going to be putting those in the chat and in the Zoom as well. Come and join us. We are going to be talking about breastfeeding myths. We're going to kick off World Breastfeeding Week and month. August is the month for breastfeeding. So we're going to be talking about and kind of unpacking what are the things that we hear commonly about breastfeeding that are actually not true, fact, fiction. And let's dig in and dive in a little bit deeper into those. So I hope that you'll all join us. I think it'll be very informative and very interactive as well. So with that, we will pop off Facebook Live. Thank you everyone who is watching live, and to all of our Zoom participants today. We'll have a few more minutes to chat.